Okay, we're here with the great Bianca Hassoun from Illinois. Hi, Bianca. We miss you out here in Maryland. And we're talking IPE. I have to give props to all of to Kent Morris and all of the IPE gurus, my little sis from NYU, um, Dr. Manal Ibrahim, who's actually a little bit in your area. You may
Yes,
know her.
yeah, Naperville.
Yeah. So these are the IPE gurus, and there are others who absolutely, and we have within our own cohort in Maryland, Karen Benitez says she can't live without it. That is you associated for her in your Maryland days. So all great people. You've been fortunate, and so I'm fortunate enough to meet you. And you asked some very good questions about the IPE, which brings us to our IPE protocols. What would I recommend as far as how to train a patient, what to tell a patient and a parent in the first initiation of IPE. So the reason rapid palatal expansion works is because it's rapid. So they'll be, when you have an RPE, doctors will tell you to turn that screw twice a day, right? That's really, truly rapid. Twice a day is very difficult to do with an IPE. So the way the IPE works is you give sequential aligners, so to speak. What we recommend is we tell the patient to wear it even when they're eating. So they're never taking it out of the mouth except for once a day or twice a day, whenever they want to, just to clean it, rinse it off, and it snaps right back in. Okay. So we're not going to talk now about the attachment designs and those kinds of things with the learning curve, but the very basics of what to tell a patient in terms of when to wear the IPE is as follows. Wear it all the time, including eating. It's still more comfortable than an RPE. It's still better than a parent turning a jack screw at home. Question then becomes a very important, essential question is how often do you switch them out? You'll give them a bag. In this case, Bianca and I have determined that the patient needed about 11.75 millimeters of expansion. So that's the full complement of 48 expanders. Mind you, it's not like 48 aligners that'll last you a year. At once a day, you're talking about less than 2 months, about a month and a half of treatment. So you can't just bring them in every 3 months or every 6 weeks. Now, it is nice that there is a limit to how far the arch can expand, because after all, it is obviously limited by the dimensions of the last aligner. So you won't get what sometimes called Kent Morris shows cases where a patient with an RPE just kept turning and then realized they were supposed to stop turning and then kind of disappeared and then came back and had Brody bite, telescopic kind of cross bites. Those kinds of things are not going to happen with an IPE either. So it is more comfortable, easier on the patient, easier on the parent, and more control. In addition, it has a lot of the intrusive benefits of having the occlusal coverage. So that has an intrusive benefit, more like a Haas, where instead of having a Hyrax, you're talking about there are certainly a lot of benefits to having that those arches disclude, especially in a situation where you have a crossbite, which is so common in these cases. And perhaps even having some of the control over the teeth along the where you have occlusal coverage overlapping onto the buccal surface of the teeth can control some torque as well. So many potential benefits to the IPE, but of course the patient has to wear it. So that's why we say don't take it out. This is not like the aligners. This is in direct contrast with the aligners when we say nighttime wear only to the 6 and 8 year olds and the anterior development will happen. This is really skeletal movement that depends on a constant force. And therefore, if we're going to break the suture, we're going to need to be on that all the time. And so once a day. Now, doctors have found that when they only do a switch out, when they do the switch out once every single day, sometimes the aligners tend to ride up on the molars and you start to lose the engagement. It's not fully engaged in the palate, and it has to be obviously fully seated in order to have the proper effect. And therefore, I would recommend, perhaps for your consideration, Bianca, the following protocol. Tell the patient to wear it every single day. I think that rapidity is important. To do it once a day, if you can, will get you the best, most efficient results. But give them 2 weeks, 10 days, 2 weeks, whatever fits in your schedule. Give them 2 weeks ish and then bring them back into the office. When you bring them back into the office, tell them to bring back all of their aligners. That's a little life hack I learned from Kent Morris when we lectured together in Manhattan, in New York City. And that enables you to assess. Now you're checking to see how fully seated it is. If it is fully seated, then that's the best. Continue. You're golden. You continue once per day and just keep switching it out. Where when you eat, just take it out to rinse it and to clean it and put it back in and let's go. And then maybe you can see them a month later. A month later, they'll already be up to 44. They'll be towards the end and you'll see where you are then. Okay. If you were so inclined. If you want to see them every 2 weeks, then by all means. But you may not need to, right? In a situation where you know that they've been compliant. Another common scenario might be they're coming in 2 weeks later. And if they report that they did okay with it, but you see that it's not fully seated, then you know that once a week, whatever reason, once a day rather, is not enough time with each aligner for them. So you have to modify that. And I've seen that. Dr. Manal did mention that when I took a webinar of hers on this topic. She does it every other day. So every other day, it would not be my initial ideal, but you could always switch out to every other day. But here's where Kent Morris's plan comes in. You always tell them to bring in all the aligners because you don't want to rescan. This is, again, opposite. So IPE in certain ways is opposite of pediatric aligners. You do not want to rescan this. That becomes too unwieldy. Instead, what you rather do is tell them to bring in all the aligners and then just go back to see. Let's say they're in aligner number 14. That's not seating. Go back to 13, 12, 11. Ooh, 11 seats well. So now my recommendation would be start with 11 and wear it for 2 days. And now you're switching to 2 days per because you're noticing that 1 day per aligner may not be enough. So maybe now switch to 2 days per if you're going back. Obviously, if you're only going back to 13 and everything up until 13 fit really, really well, maybe just wear number 13 for 2 or 3 days and then number 14 for 2 or 3 days and then go back to 1 day per. You know what I mean? But if you have to go back all the way to number 8, let's say, so that's probably a good indication that somewhere along the line, you're going probably twice as fast as this patient, for whatever reason, can tolerate. But if they could do it every 2 days, then try that and then bring them in 2 weeks later again in order to see if that pace is working. Many doctors have reported that that pace works very, very well. It's still, if it's every 2 days, it's still fast enough in a young enough patient to split the suture. So it is not really lost anything. And then you go as far as you can till the end and you evaluate at that point whether you got the expansion that you needed. And then, of course, you could order more aligners at that point if you need to.